Today in this tutorial I will discuss about the boundaries of the posterior triangle. So when I am saying boundaries, what does this mean? It means that if any structure is present somewhere, it must be bounded from all the sides by some other structures. So we are concerned here about the posterior triangle. So it is a triangular space, so it must be bounded anteriorly with something, posteriorly with something, and there must be something on the top and there must be something on the base. So this will form the boundaries. Let us discuss what forms the boundaries of the posterior triangle. So on the anterior aspect of the posterior triangle, we all know that sternocleidomastoid muscle is present. So on the anterior boundary will be formed by sternocleidomastoid muscle, but the posterior border of sternocleidomastoid muscle will form the anterior boundary of posterior triangle, and the posterior boundary will be formed by which muscle is present posteriorly? Trapezius muscle is present, and the anterior border of trapezius will form the posterior boundary of posterior triangle. The base is formed by middle 1/3 of clavicle. On the base we have clavicle bone. So the middle 1/3 of this bone, the clavicle, forms the base, or you can say the inferior boundary of the posterior triangle. The apex lies at the superior knuckle line. Superior knuckle line is the curved bony arches on the occipital bone which starts from the external occipital protuberance. So the apex lies on the superior knuckle line where the two muscles, the trapezius and the sternocleidomastoid muscle, meet. So here in this picture we will understand the boundaries of the posterior triangle. So here you can see I have marked the sternocleidomastoid with yellow color, and the boundary of the anterior boundary of the posterior triangle by red color. So the anterior boundary is formed by sternocleidomastoid. Which border of sternocleidomastoid? The posterior border of sternocleidomastoid muscle. Now coming to the posterior boundary. So this is the trapezius muscle which I am marking by yellow color. So, and the boundary I have marked with red color. So the posterior boundary of the posterior triangle is formed by the anterior border of trapezius muscle, and the base is formed by the middle 1/3 of clavicle. Here I have marked the middle 1/3 of clavicle by yellow color. The apex is formed by at the superior knuckle line. You can see skull, portion of skull is shown here, and this is, you can see this 1 minute. So apex is formed at the superior knuckle line on the skull where the two muscle, the sternocleidomastoid and the trapezius muscle, meet. Again, to make it more clear, here you can see this bulky muscle, very prominent muscle, is the sternocleidomastoid. It has two heads of origin. You all know that sternocleidomastoid arises from the clavicle and the sternum both. It has two heads of origin. So this muscle which I have marked with red is a sternocleidomastoid muscle. So anterior boundary will be formed by the posterior border posterior border of your the posterior border of sternocleidomastoid muscle, and the and the posterior border boundary is formed by the anterior border of trapezius muscle. Here I have marked the trapezius muscle with yellow color, and the red color is showing the posterior boundary of the posterior triangle, or you can say it is the red color is showing the anterior border of trapezius muscle. Okay, and the base or the inferior boundary of the posterior triangle is formed by the middle one third of the clavicle. Here I have marked the middle one third of the clavicle with the red color. Now the apex is formed at the superior knuckle line of the skull, where the two muscles, sternocleidomastoid and the trapezius muscle, meet. Here I have shown the apex with red color. Now coming to the floor of the posterior triangle. Floor of the posterior triangle. Suppose I am sitting in a room and I have to look the floor from the top. Then what will I do? I will remove the roof and then I will enter the room. And suppose there is a carpet placed on the floor, then I will have to remove that carpet to look at the floor. Suppose a square shaped room is there is no door, and you have to come from the top, that means you have to come from the roof side into the room. So you will have to remove the roof, and then in the room, when you enter the room, you see that there is a carpet placed on the floor, and you have to look the floor. Then you must have to remove that carpet from the floor to look at the floor. Okay, so the floor of the posterior triangle. So in this case here we are studying the posterior triangle. So in the posterior triangle, when we have to look the floor, what we will do? From superficial to deep in anatomy, whenever we study anatomy, we do dissections, then what we do? We remove the skin, then we remove the subcutaneous tissue, then we remove the deep fascia, and then we go inside. There may be some contents present, maybe nerves, vessels, organs may be present, and then we will go deep. Their muscles may be present. So in case of the posterior triangle, the floor is muscular. It means that the muscles are present in the floor. Okay, so which all muscles are present in the floor? When we look the posterior triangle from above downwards, then we get three muscles: splenius capitis, levator scapulae, scalenus medius. Okay, splenius capitis, levator scapulae, scalenus medius. And in the lower part we get scalenus anterior, scalenus posterior, and the first digitation of serratus anterior. Here you can see scalenus is divided into three parts: scalenus anterior, scalenus medius, scalenus posterior. These splenius capitis scalenus muscle are the prevertebral or paravertebral muscles. Prevertebral means the muscles which are present in front of the vertebra, and paravertebral means around the vertebra. So these are the prevertebral or paravertebral muscles. Okay, splenius capitis, levator scapulae, and scalenus medius. When we look from above downward, we will get these three muscles, and in the lower part of the posterior triangle we get scalenus anterior, scalenus posterior, and first digitation of serratus anterior muscle. And at the apex, when we remove the splenius capitis, we get semispinalis capitis. Here in this picture you can see at this picture is the transverse section through the neck at the level of 7th cervical vertebra. Okay, you can see here this red color. I'm marking with the red color the sternocleidomastoid muscle, and then I'm using the blue color to mark the fascia. Okay, and so here I have marked with the red color. Anteriorly is showing the sternocleidomastoid muscle, and posteriorly I have marked the trapezius with red color. Okay, and the blue color is showing the fascia, the deep fascia of neck. And which deep fascia? The investing layer of deep cervical fascia. So this investing layer of deep cervical fascia encloses the neck like a collar. It splits to enclose these two muscles, the sternocleidomastoid muscle anteriorly, and posteriorly it splits to enclose your trapezius muscle. And you all know that the space between these two muscles is the posterior triangle. So this area which I am marking with yellow color is the posterior triangle. Okay, this area is the posterior triangle. Okay, so what all we get in this posterior triangle? Now again, here I have marked with yellow. This is the prevertebral layer of deep cervical fascia, which is covering the muscles of the floor of posterior triangle. So this prevertebral fascia forms the carpet of the posterior triangle. It means it is covering the floor. The muscles which are present in the floor of the posterior triangle is covered by prevertebral layer of deep cervical fascia. Okay, so these are the muscles shown here in this picture. You can see scalenus medius is shown, scalenus anterior is shown, and we have many others. Prevertebral fascia, you can see the prevertebral fascia is covering these muscles. Okay, so these are the muscles which are present in the floor of the posterior triangle, and it is covered by the prevertebral layer of deep cervical fascia. And so this prevertebral layer of deep cervical fascia forms the carpet of the posterior triangle. Now here in this picture you can see the floor of the posterior triangle. From above downwards you can see splenius capitis, then we have levator scapulae, then we have scalenus muscle, the anterior, middle and posterior you can see. Okay, So these are the muscles which are forming the when we will this which are forming the floor of the posterior triangle, and when we will remove, we will give a incision between the trapezius and the sternocleidomastoid at the top, at the apex point here. Then we will able to see the semispinalis capitis also. Okay.